टेस्ट कर लिया?
Oh yes, oh yes.
ये एक बार हमने इसमें इंटरव्यू किया था।
छाबरा जी ओपनिंग बैट्समैन है।
Hi Sunil.
Dr. Chabra, welcome to you.
Thank you, sir. Thank you.
Okay, let's start now. I am Amresh Tiwari. I am editor, publisher.
Dr. Chabra, good evening.
Good evening. Good evening. हमारे कोरोना वॉरियर हाँ जी सर, sorry.
Am I request all of you please cooperate to listen to me. I am Amresh Tiwari. I am editor.
इसको साफ कर देना.
There is some disturbance from our audiences.
हाँ, इसमें आवाज.
It's okay.
हो गया.
आप अपना म्यूट कर लीजिए बस. हाँ ठीक है.
Okay, let's start now.
Yes please.
I am Amresh Tiwari. I am editor, publisher, Double Helical. This is a leading national health wing and which is being published from Delhi NCR region. Now it's a great moment I welcome all of you on behalf of Double Helical. And today is a topic as Dr. Girdhar Gyani must let you know about that management of COVID. And it has a 4 contemporary parts: controlling spread of infection, mitigating fear among health workers and patients, and third one is minimizing fatalities, and fourth one safe society in the new normal. Now, I really thankful to our moderator, our speakers like Dr. H.S. Chabra, he is the MD, Indian Spine Injury Center, New Delhi, and Dr. Yes Gulati, he is the Padam Shri and Apollo Hospital, New Delhi, Dr. Sunil Khetrapal, Rajiv Gandhi Cancer Institute, and Commander Navneet Bali is a very renowned figure and regional director in Narayana Health. Welcome to all of you. Apart from this speaker, I also welcome to my advisory board member like Dr. Girdhar Gyani ji, Dr. Arvind Agarwal, Dr. Vijay Agarwal ji, Dr. Vinay Agarwal. Now I hand over to Dr. Girdhar Gyani. Please start this webinar.
Okay, namaskar and very good evening. I think COVID is with us for past 6 months. We were so afraid of COVID in first 3 months, and by the time then we started, reconciling that we are not to be afraid of the COVID, but we have to manage the COVID. We have to live with the COVID. We have to find the ways and means how we can reduce the fatalities. If you see that fertility went up to 3.3, 3.4% for a substantial period of time, but today we are in a way happy that the fertility has come down to 2.2%. But our considered opinion, when I talk to my colleagues in the healthcare, they tell me that 2.2 also is high. There is no reason that we can't manage the fatalities actually to 0. You see, that is the way ideally we have to bring down the fatalities. And this is possible not simply due to the protocols, because the medical protocols, clinical protocols for the COVID treatment is not very difficult. It is comparatively very easy protocol. The question is, how do you manage it? How do you identify, right at the right stage and guide the patient, whether go for home quarantine or they shift to the COVID center or they shift to the COVID hospitals? I remember in the initial period, every patient, even asymptomatic patient, used to be put into the hospital and he used to occupy the hospital bed. Delhi, particularly, I have been following, we are in Delhi, that we used to see that Delhi will never ever face the problem because Delhi has got total of 53,000 beds. Actually, the best density ratio in the country, Delhi has got. 53,000 is a big number, out of which around 25,000 beds are in the private sector, around 12,000 beds are in the Delhi government, and remaining are with the central government. But we were actually shocked that at some point of time in the early part of June, that we found that we didn't have the beds. In fact, Delhi government kept saying that they still have beds, but actually the reality was the beds were there, but there were no doctors, there were no nurses, there were no staff. So virtually those beds were not of any help to us. But today, when we are sitting here on 30th July, we again have come to the point that beds in private sectors are available, beds in the real beds, I will say, in the government sector also are available. So this has been possible. How have we managed the COVID? This has been the case in world over, even world has learned, but I can definitely say one thing, that India has learned faster. If you really see the way kind of fatalities has happened in Brazil and USA and earlier in Italy and China, we have, I don't know, by the grace of God and by the active participation of our healthcare workers, I think we have been able to manage the COVID. This is in spite of severe limitation of the resources which India has in terms of doctors, in terms of the hospital beds. But even then we have been, now actually if you really see that, although we keep saying that we have got 15 lakh cases, but if I really see, we should now start looking at what are the active cases actually, which is around 5 lakhs now. And Delhi is a very good example that Delhi, the number we keep saying in the newspaper, in the television, 1,33,000. But if you see today, the active cases are only 10,800. And Delhi, by the way, is having the best recovery rate, 89% as compared to India average of 64%. So I think these are some of the areas which actually gives us a sense of satisfaction that we have been able to manage the COVID. But as I again said, we have still a lot to do to manage the COVID, because COVID is not going to go away very soon. Virus is going to remain around us for quite some time. And that is where I think this webinar today, which is live on Facebook and even the YouTube. So most of our listeners are on the Facebook. So we are going to throw light on this very important area of the management of COVID. And to begin with, we have, of course, not to begin with, we have choosing the 4 experts in the area, and they will be sharing their experience on the 4 topics which we have identified. The first topic, of course, is the simple one, which is not simple in the sense, this is affect the common man. That's why I'm using word simple. It affects everyone. It is not simply for the medical fraternity, but it is also for the common man to understand that how can we minimize the spread of the infection. Because as I said, virus is there. It will remain there. But can we not allow it to spread further and confine it wherever it is? So I think this is a very key point, because as we say, it is a beginning one. If you control the spread, the management becomes much easier. And if you spread it unnecessarily, because resources again are limited. And let me point out one thing here. Sitting in Delhi, we may be really boastful that we have so many beds. But if this spreads in the rural area, in the tier 3 towns, we do not have the resources. Actually, that is where I think we have to be very careful that how do we minimize the spread. The second topic will be that the fear which actually continues to be there, among the doctors, among the nursing staff, among the healthcare workers, and of course among the patient actually. I really have to mitigate this fear. This is a very important area. Then, of course, is the one very clinical topic that how do we minimize the fatalities. And last one is how do we live with the safety. One is that we feel normal, nothing to worry about it. No, we can say that we have nothing to worry, but with the rider of the safety. So how do we live in the safe society in the new normal? So these are the 4 topics and 4 speakers. And where I am very happy to say that we have a galaxy of the experts we have chosen, and the opening will be done by none other than Dr. H.S. Chabra, who is the medical director of the Indian Spinal Injury Center. and who I will say is acclaimed clinician, doctor, orthopedics and the spine. Not only India, but globally, his work is recognized. So we are very happy that he is going to start the webinar. So may I start and invite Dr. Chabra to tell us how you think we can minimize or control the spread of the COVID infection. Dr. Chabra.
Thank you, sir, for your kind words. I hope you can see the screen. I've shared the screen. Is my screen visible, sir?
Yeah, that is good.
Right. So, sir has very well summarized the topic, and my responsibility is to discuss about controlling the spread of the COVID infection. Sir has mentioned how we are in the midst of an unprecedented health crisis. We would probably not have dreamt that we would be in this situation around 6 months ago. And the movie Contagion, we would have passed off as a fiction. But lo, today we are in the midst of a fiction per se. And this is not only a health crisis, but it has become a real economic crisis and is turning into a massive fiscal challenge for all of us. We are aware that where the problem lies, though there is much talk about a successful vaccine coming soon or a treatment almost on the threshold, but as per experts, it may still take some time before we can have a successful vaccine. In fact, if you talk about all the viral diseases, we hardly have any successful vaccine per se, but this may be a change. We have to hope for the best. We have to hope for a successful treatment, but it may take some while before it is there and before it reaches the masses. So this is likely, as Sir also said, Dr. Gyani, to be an ongoing challenge, both to protect the health and preserve the economy, the businesses and the workers and the healthcare industry per se. So implementing ways to control the spread of the virus without affecting the economy is the only strategy to control the pandemic as of now. We are aware that on 24th March 2020, India was one of the countries which took action quickly, and our Honorable Prime Minister declared a nationwide lockdown. It slowed the growth rate of the pandemic. On 30th May, it was announced that the lockdown restrictions were to be lifted from then onwards. From 8th June, we started the Unlock 1. From 1st July, Unlock 2. And we will have from 1st August, the Unlock 3 per se. The lockdown, people have different opinions, but it achieved its objectives of flattening the epidemic curve. It gave us time to get geared up, and we even otherwise got a lead over the other countries in that we could prepare our health infrastructure, the staff, and get ready for the pandemic. So unlock is necessary to restore the economy. But as has been the experience in other countries, with the pandemic still not fully controlled, as we unlock, if we do not implement other strategies to control the spread, we may have a second curve soon. So it is very important to control the spread of the infection, and that this can be done has been very evident from other countries, some other countries which have not resorted to lockdown, but from the first go, implementing other measures of controlling the spread of infection, they have been able to control the pandemic almost as well as countries which have gone in for lockdown or other measures. But that requires a lot of coordination, a lot of motivation, and for everybody to be involved. And as has also very often been mentioned, this pandemic is a warlike scenario, and it requires the cooperation and involvement of almost the whole nation, in fact, the whole globe, in controlling the pandemic. So it can't be just expected at the level of the individual or at the level of the government. It has to be a multi-pronged involvement at each level, whether it's the government, the bureaucracy, the health system, the media, the individuals. So everybody has a role to play if we have to control the spread of the pandemic, if we have to limit the morbidity and the mortality due to the pandemic. So I think that is the topic of the discussion today. When it comes to the government, the center and state, we know there are the responsibilities of testing, identification, containment, treatment, communication and research strategies, developing infrastructure, funding arrangements for health system, ensuring safety of service provider, health infrastructure, insurance for first-line workers, having a regulatory framework for robust implementation, analyzing and forecasting the sectors which may face collateral damage due to the government policies related to a pandemic, addressing the ramifications of pandemic beyond the health systems, and provision for management of similar events in the future. However, if we were to look into a strategy of what could work for the nation once we are out of the lockdown, people say it should be 6 steps to keeping the curve flattened sustainably and flattening it further. So one of the first step is to keep the preparedness accelerated. So massively expand and speed up the testing process, provide related kits and supplies, medical devices needed for care, protective equipment for healthcare workers, have expanded facilities for treating the ill. So this is one step. Always remain in an accelerated state of preparedness till we are through with the pandemic. We may need to change the social distancing paradigm because, as we discussed, it is important to prevent the spread of the infection, but it is equally important also to restore the economy. It should not be that people die because of starvation more than those who die because of the pandemic per se. And that is a reality for a large number of daily wage earners, and even otherwise we can't let the economy go into a roll down. So we have to try to identify those who are at risk. We know age, comorbidities, and immunological compromise are the risk factors. And then with careful epidemiological analysis and modern analytical techniques, create risk stratification methodologies to allow lower risk individuals to get back to work while responsibly decreasing the risk to themselves and society. And then we have to resort to cocooning of the vulnerable population. So allow those who are less at risk to move out and protect the vulnerable. The third is change the operating model. So accelerate the use of digital and mobile technologies to make remote work and other activities easier. So you may need to adapt to a more intrusive environment, like the digital scanning should be acceptable. Use artificial intelligence to notify at-risk individuals to self-quarantine. We know about the Arogya Setu, right, app. Antibody test for immunity surveillance can be used. The next step is to adapt regulatory and support frameworks. So give organizations the right to protect their businesses, workers, customers, and students with testing, as well as the obligation to require at-risk people to stay home. Sick leave support and medical care should be extended when the workers or their loved ones get sick. Create protection from the virus-related lawsuits for medical professionals acting in good faith. So we have to protect those people. The next step is invest in and support innovators. So development of diagnostics, antivirals, and vaccines. Invest aggressively in capacity to deploy therapeutics at scale before we can be certain that they will work. And the sixth step is increase the communications dramatically, right? There should be a consistent, coherent, unified leadership, especially in a war-like scenario. They say there should be one general. If there are too many generals, it causes a problem, right? And there should be a clear communication, and then everybody lower down should be able to implement the clear communication such that we all move forward in a disciplined manner to overcome the pandemic. So this is the government's role, but all of us have to play a role in this. At the bureaucratic level, which would be the health sector, police and paramilitary and education sector, there has to be understanding, implementation, information dissemination, and monitoring of the government policies, handling the day-to-day challenges faced by the grassroots level implementers, developing and supporting strong means of communication, and emphasis on care for the vulnerable population. At the health system level, which would be healthcare providers, healthcare professionals, and support workforce, professional societies, and health support organizations like Double Helical is doing this webinar, and the intention is the same. So the interventions would be adopting, training, and implementing the government policies, create fast-track infrastructure for management of patients, sensitization of consumers about government policies, establishing strong communication channel with all stakeholders, and propose innovative and cost-effective solutions for deeper penetration of government program. At the media level, whether it is press, print, electronic, social media, or grapevine, all the modes of effective communication to be exploited to the fullest. Rumors and panic control strategies should be there. Revision of policies and protocols to be clearly communicated, and establishing call centers, help desk, dashboard for public information should be there. And then at the individual level, we are all aware of the policies and the protocols for self-isolation, for quarantine, of all the methods which work. I will not repeat it, but the essence would be physical distancing, good hand hygiene, cough etiquettes, things like this. And so it has to be the individual, the residents of the society, and everybody has a role to play when somebody in the locality develops an infection or is in quarantine. So I will not go into the depths of it because all of you are aware about it, but we should be sure that everyone in our locality knows about it. We should avoid large assemblies and large groups, and that's why this webinar is happening, and we are not assembling at one place to get together and discuss about it, right? We should let this filter down to everyone. And there are various tools to make people aware like this from the WHO or CDC guidelines, and we have to follow them to the hilt per se. And these are very important, as Dr. Gyani also mentioned, and especially as we open up, as we unlock, there's a chance that we have a second peak, and we need to be more meticulous in the implementation of strategies at this time. So what would be the carry-home message? The carry-home message would be that together we can. No boundaries can stop us from winning. So we have to be together in this fight. It can't be done in isolation. The government alone can't do it. Everybody from top to bottom has a role to play, and unless one does it like one does in war, we will not succeed. And we have to succeed because there is no other option available. I am responsible for not only myself, but also for others. My body, my responsibility has to be the dictum. We have to echo from individual to society, to states, to countries, and across the continents. Very importantly, we have to keep a positive attitude and thinking, right? Like Pakistan on the last ball used to hit a six and win over India, but ever since this positive thinking has come back to Indian cricket, we have started dominating. Similarly, this is a real life scenario where we have to have positive thinking and we have to win because we can't lose. And we have to, everybody has to have respect and faith in government policies and guidelines. We can't have a divided politics ruin our chance to succeed. Everybody has to side with the government. What they decide for us, we have to believe in them that they will do it for our welfare. So that, in a nutshell, would be the carry-home message. Thanks for your patience. I hope I've been able to deliver what was expected from me. Thank you.
Thank you very much. Actually, I can't believe it, the kind of road Chabra has put in front of us. This is a blueprint which can be used by all of us. And what he said in the last, together we can win, and the positive attitude. I think these are the two very important factors. Besides the the way he has prepared and summed up the roadmap for all of us, I think we can share it through with the government and with the other NGOs and even in the RWAs. I think I'm sure Amresh is going to print this PPTs in the magazine so that it reaches out to the people in the earliest possible issue. Thank you, Dr. Chabra.
Thank you, sir.
Now I will move to another important connected topic, I will say. You know that when we started, actually, we used to have, extreme fear. Doctors, my colleague used to tell me that actually the things which are there, lack of PPTs, lack of protocols, they used to be really worried that when we are treating patient or we are protecting ourselves first. So their attention used to be ourselves, because that was the kind of fear which luckily I think we have been able to overcome. But still we need to work on it. Similarly, the fear among the patient, for the non-COVID treatment also, they are hesitant to come to the hospital, which is not good. And it will have very detrimental effect on their own health in time to come. Accordingly, similarly, the society at large also. So I think we have to overcome this fear by maintaining the precaution what Dr. Chabra mentioned to us. I would like to invite Commander Navneet Bali, Regional Director for the Narayan Health Group of Hospital in the Northern Region. A commander, when I am saying his armed forces, sir, I am sure none other than him can tell us how to overcome and mitigate the fear. May I invite Commander Navneet Bali.
Thank you, sir. Thank you so much for the introduction, and thank you, Dr. Chabra. You can hear me, sir, loud and clear?
Yes.
So at the outset, thanks a lot for inviting me for this very wonderful webinar, and very timely also. And thanks for all the participants who are listening both live and on the various channels on the social media. Many similarities have been given with what the situation we are faced right now, and with war. It's been given with how a soldier deals with the situation, and it's been called that we are in a state of war, in a different kind of a war. So I think both being a healthcare worker myself today, managing 3 hospitals in the north and some clinics here, and passing through this phase, and also around 24 years soldiering myself, in the Indian Navy. So I can understand, what the whole thing is going on, and I'll try to sort of give my views on this whole situation. So, we're talking about fear right now, and uh, as we all know, that fear can be a fear of the known, and then we have the fear of the unknown. And then, we also have a little bit fear of getting small hurts and, things like that. But in this particular case, we are faced with a situation where it was a fear of unknown, first of all, and it was a fear of life, and not only your own life. And as a healthcare worker, you were also fearing the life of your near and dear ones when you went back home after doing your duty in the hospital. So, it was a situation which was very, very sort of typical, and, this was all around the place. And why did it happen so much, and why initial, I'm talking about once we were in the initial parts of this pandemic, what was going on exactly was that, first of all, we just did not know what was happening. There was nobody wiser across the world. We were looking at majority of the organizations, which have tall claims to fame, even them faltering. We had no such, pole star. We had no such guidelines. We didn't know actually, what we were going through and what was happening. And this, despite the fact that the world has gone through 16 pandemics in the last 20 years. It was as if, something new has come in front of us, and we just did not know what was, what was happening. The second important factor which led to this massive fear factor was in the fatalities amongst the healthcare workers in even the most developed countries, and we were getting this news constantly, what was happening in Spain, what was happening in Italy, what was happening, many of these countries where supposedly their healthcare systems were very, very robust. And, these countries, they had, so this was the second factor which was playing on the minds of, most of the healthcare workers of what was happening here. And we were getting this information, continuously. The third factor initially was the supply chain issues, where there was an acute lack of PPEs. We know very well, when we started going through this phase, to get a PPE was such a Herculean task. And the cost of the PPE was so exorbitant, that nobody thought that you could procure it. And we were thinking of importing PPEs. We were thinking that, this situation is going to continue. We are not going to have adequate PPEs. Obviously, as the time has progressed, we saw that industry really took up the challenge and has come forward. The role of social media, and this was, I think, another great factor which completely contributed towards huge amount of fear, because unlike earlier times when things used to come on a newspaper and used to read it at the most on a TV this was happening live on your WhatsApps, on your other social media handles, on Twitters, etc. And it was as if the live news being played around moment, and every incident is being reported across the world. I think that was another issue which really put that fear factor into a little bit more heightened kind of thing. A change of norms continuously. We started off saying something, that we need to do something like this, and over a period of time, obviously, as we understood the virus, as we took on with more and more experiences, I think the norms continued changing from one spectrum to the other, and there was no clarity at all. There was an absolute confusion. There was no clear clinical protocol, and even today, if you ask me, although we are much wiser, but nobody goes on to say that now today we have found a clinical solution. Forget about the vaccine. I mean, let us keep that part to one side. Even today, we do not have a 100% clinical solution to this battle that we're going on. So there was an utter confusion on that regard also. When we were experimentally, it started off with HCQ, and then it came down no HCQ, then it started off with antibiotics and steroids, then many new innovative drugs and experimental drugs came, then plasma therapy came. So we've been evolving. At the same time, in the because there is no clarity, and when there is no clarity, the human mind automatically goes into that overdrive when it starts thinking of what's going to happen. In the initial stages, obviously, there was a huge amount of confusion in the policymakers. But I think most of the places now, at least we can say that there has been some semblance of clarity, and policies have started aligning when policymakers started listening to epidemiologists. They started listening to the doctors. They started listening to the people who had gone through this many times before, and then wise wiseness prevailed, and today we have a situation when some semblance of sanity exists. This one. And also in the initial parts, the managements of many healthcare facilities were not very supportive. That was not because of their design or they wanted to do so, because even the management did not know. PPEs were not available. The management was seen as unsupportive towards the doctors when there were lack of PPEs. People did not have even masks. So that scenario also was playing on the psyche of doctors. And last but not the least, we had a very unforgiving society. A doctor became infected by let us say a healthcare worker was infected by COVID. I mean, the landlord threw them out of the houses. There were issues throughout the country, and I don't know across the world what was happening, but at least we saw this happening, and there were newses across that this is the issue when healthcare workers, doctors, nurses, paramedics are not allowed to go back to their houses, etc., etc. So there's a whole lot of confusion happening around what was going on. One of the greatest fears, I think, when I talked to many of the doctors was, sir, if something happens to us, what will happen to our family? If something happens to us, is there an insurance? If something happens to us, will you take care of us? What about my family? I have an old mother, I have an old father, I have a kid in my home. So what happens to them? So healthcare workers also, because of this, what they were going through right now, were not in a very a state where they could go ahead and fight this battle with no fear. So they were not equipped properly to go ahead and fight this battle. I met a health minister of one of the states recently, and we were donating some ventilators, and I was one-on-one talking to him, and he said, Commander Bali, can you please tell me how are you keeping your healthcare workers motivated? He did not ask me what protocols are you following, do you have adequate number of beds? Nothing. He said, what are you doing to do so? So even imagine a healthcare, a health minister at some time, was faced with the dilemma of how to motivate the healthcare workers to go ahead and, do so. So that was, but I know I'm very happy to say that was a state sometimes back. And what is happening today, let me address one by one, what are the issues, the points that I took up. So supply chain issues have been largely addressed. We have no shortages of PPEs, today in most of the hospitals, and in fact, in good hospital chains, across, that situation has been addressed. As of now, except barring for a few states and, of course, going into the second wave, etc., etc., somewhere we are not bad as far as the beds are concerned, and we are quite okay in majority of the places. Some places like, Karnataka, etc., are still, going through that phase where, where the beds are still in short supply. Most of the private healthcare managements today are very pro healthcare workers. They are going all out to ensure that their healthcare workers are supported by providing the PPEs, by following the rosters, as Dr. Chabra was mentioning, then aligning themselves as to the policies, how many days they should be on duty, how many days they should be off duty, and following it very sort of clearly, so that they are also very clear on what protocols they are following. Government also and many healthcare institutions have come out with insurance policies for the healthcare workers. If God forbid something happens to them, there are some states which have gone about financial benefits to the doctors, nurses, and staff, etc., etc. So that obviously is not a great mitigating factor, but it gives some kind of a solace, some kind of a this one to the healthcare workers that we are with you. The society has become much more supportive now, and society has started understanding that if you are not going to keep your soldiers or the people who are actually fighting this battle, you're going to be in a very bad shape tomorrow. So somewhere we see a shift in the way society is looking at. In fact, many places the society is very supportive of the doctors. They go all out to take care of them. And I also seen one change in that most of the healthcare institutions have started telling their doctors, nurses, etc., that let us say, God forbid, you turn COVID positive, we will look after you. They are admitting their doctors when they require admission at their own facilities. They are, they're trying to ask them that if you have a elderly mother at home or a father, a child, don't want to go home, we will take care of you. In fact, going a little bit more further, even the families of the healthcare workers are being taken care when you have such a situation to mitigate the fear. So largely, but for the fear of unknown, which still exists because there is no treatment for COVID, many of the other fears have been mitigated, they have been taken care of, and I think moreover, the healthcare institutions have become much more empathetic towards the doctors. What we need to do in the future, and as we go into this, I don't think this pandemic is ending very soon. I think we need to continuously create awareness in the society. That is point number one. In pockets where you still feel there is some kind of antagonism, there is some kind of a lack of knowledge towards this, that healthcare workers need to be supported. That has to be a continuous job, using social media, using every kind of a platform. Empathy towards healthcare workers and nursing staff. It is exactly same as what was talked about, that if you don't motivate your soldiers, they're not going to be able to fight the battle. And also to equip your doctors very clearly, this PPEs and masks, etc. I think it has to become a norm over quite some time in the future, so that doctors are continuously taken care of. Financial benefits certainly add up to the value. They are not the alpha and omega of mitigating fear, but certainly if insurance policies towards doctors, and they are made aware and they actually are on ground given, I think that gives some kind of solace to the doctors. And last but not the least, you need to make your healthcare workers, and this topic was about healthcare workers, more assured that the healthcare institutions will take care of them when they face this dilemma, because they also are human beings, and they are likely to get infected much more than anyone else, because they are in the battlefield. And not only them, their family members also will be taken care. I think that gives a huge amount of motivation and support to them to carry on with this battle, because this is not ending in very, very near future. I think if we take care of all these as a society, as a policy making institution, as governments, as private healthcare, and as institution where these our healthcare workers are working, I think to a great extent we'll be able to take care of and mitigate the fear. Thank you very much, Dr. Gyani.
Thank you so much. Actually, I am already seeing the feedback to me, and they are saying that the commander is speaking with so clarity. And on that, one of the comment also is that this fear also happened because there was a lack of clarity by the government in the beginning, because of the confusion that all the load was to be taken by the government, later on abruptly transferred to the private sector. And in between home quarantining, COVID centers and hospitals, the demarcation was not very clear. But I think it was very likely also, as you have said very correctly, this was the first time this kind of pandemic was happening. So, but all said and done, I think we are happy that clarity has emerged to a great extent. But as we keep saying that there's always a room for the improvement. So I think obviously, I think what you mentioned, is going to, the fear is already, I think, quite a level it has subsided, and your talk has really helped listeners, particularly to face the COVID boldly, but also with the safety. So thank you very much. And now I will move to the next our speaker, Dr. Sunil Khetarpal, who is the Chief Transformation Officer at the Rajiv Gandhi Cancer Institute. Before that, he was the medical director of the same hospital, and he, of course, has the wide experience in the various positions in Delhi, in the administration of the hospitals. And incidentally, I will like to mention here that he also had undergone the complete cycle of treatment because he became COVID positive, and he has passed through the complete cycle of the treatment. So I thought none other than he would be the right person to tell us the protocols, how the protocols have transformed from early April to July now, and how these protocols are helping us to reduce the fatalities. So Dr. Sunil Khetarpal.
Thank you, Dr. Gyani, and thank you for your kind words of introduction and also very enlightening opening remarks on this very important and relevant topic. So the topic which has been given to me is minimizing fatalities by following best practices. Now, I think I will not, elaborate much on this slide. As we all know that the last year, the year 2019, ended with a very bad note, and it was the beginning of COVID era. On 31st of December, the first case was detected in the Wuhan city of China. Then the global pandemic was declared by WHO on 11th of March, and we had first case in our country on 30th of January. And the first case of death was reported on 12th of March. And the government declared COVID as a notified disaster on 12th of March 2020. So total 213 countries have been affected. And now I think we should understand what is the case fatality rate. We call it commonly known as CFR. So CFR is case fatality rate, or also called as the case fatality ratio or case fatality risk. So this is more commonly used in epidemiology. So the formula which is used is the number of deaths from a certain disease, which is used as a numerator. And the denominator is the number of individuals diagnosed during a particular period into 100. So it is very essential, but difficult to estimate the case fatality rate because it is very dynamic. It is changing every day. In case of an ongoing pandemic, the case fatality rate, it varies. Until the end of pandemic, we will not be able to have the concrete this fatality rate. Now, let me share the global scenario about the fatality. Till date, the latest, till few hours back, the information which I got is that worldwide, nearly 17 million cases are confirmed cases, and the total deaths worldwide is 661,000. And initially, WHO estimated the mortality as 2% in the month of January and February. And in March, the mortality rate was 3.4%. And in July, if you see, it is increased over a period of time. And in July, the global mortality, of course, which includes India, is 4.2%. Now, the death toll, if we see, is currently they are about 1.17 million cases, confirmed cases, and 213 countries and territories are affected. And 6,70,207 deaths have been reported worldwide as on date. Now, the world average, as I mentioned, is around 4%. And recovery rate, of course, globally is 62%, which is also good. And India, of course, it has touched already 64% recovery rate. Now, in Indian scenario, the fatality is, as I mentioned, that the first case of death was reported on 12th of March 2020, and throughout March, it remained in single digit. And in April, on 2nd of April, we touched 2 digits. There's a 15 deaths were reported. Then subsequently, in first week of May, the daily average of deaths crossed to 100. And in mid-May, it was 100 plus, between 100 and 200. And end of May, it was nearly 200 per day. So June was the peak of this disease. And the June 2020 saw a considerable increase. And the reported daily death was very high. And the rest of June, of course, it touched almost 400. So from May to June, if you see, it is almost double. And there was one day spike on 17th of June, which has, changed the total average of the mortality rate in the month of June. So currently we rank third in the world. And of course, the case fatality rate in India is least among the top six countries that are worst affected. Of course, we are third, we are the first being the USA, followed by Brazil and then India. And in India, total confirmed cases are 1.53 million. That is about 15 lakhs plus. And then 0.53 million, about 1/3 of the total cases, confirmed cases, are active cases. And deaths reported till date is 34,968. Now, Indian scenario, if we talk about the case fatality, we have done really well. And of course, the strategies followed by the state governments and the central government, they have really worked well. And India's COVID-19 case fatality rate is, as we all know, that it is progressively falling. And from mid-June to till date, it has come down from 3.3% to 2.2%, 2.21%. So which is a very, very encouraging results and encouraging report. And the current recovery rate is more than 64.5%. So you can see in this bar chart that from mid-June to end July, how we have improved upon the case fatality rate from 3.3% to 2.21%. So this is more than 1% improvement. Now, let me talk about the guidelines, the COVID management guidelines, which, the government Ministry of Health and Family Welfare has been coming out with the, various guideline protocols, treatment protocols. And there are a series of guidelines and, it changed almost 5 times. So we had a series of versions of protocols. So we are into version 5 of the treatment protocol. And as we all know that the disease is classified or categorized into 3, depending upon the severity of illness. Initially, in the month of March, it was called, the first category was uncomplicated illness. And then the second category was mild pneumonia. And then the third category was severe pneumonia. It was not mild, moderate, and severe initially. And the treatment modality, the management was mainly HCQ, which is hydroxychloroquine and azithromycin. Of course, later on, it had, because of the combined this use of these drugs, because of the cardiac issues and the cardiac problems and people with cardiac disease, we became cautious. And then came the second version on 7th of April, because 7th of April was the WHO day, and they came out with the new version of treatment, the guidelines, the treatment protocol changed to, again, then the category was divided into mild, moderate, and severe. And of course, in mild, there were, very mild symptoms with fever and upper respiratory tract infection, and moderate cases, of course, mild pneumonia, they say, and then the saturation was 94 or less than 94%. In severe cases, the saturation was, of course, very important. It was less than 90%. And the treatment protocol was that patient should be admitted in severe cases. And of course, the moderate oxygen use was advocated. And in severe cases, hydroxychloroquine plus azithromycin, it remained the same. Then in June, so in mid of June and by end of June, this treatment for the third version and fourth version, they came on the mid-June and the end of June. So third version, again, the category was the same, that depending upon the severity, mild, moderate, and severe, and even the clinical criteria, the symptoms were the same. But in case of mild, they said this was very important, that home isolation was indicated in case of mild disease, like either if you are symptomatic or with comorbid condition, even in mild case, you may need to get admitted in a COVID care center or remain in home isolation. So home isolation was something which, now again, the government is emphasizing on the home isolation, which has really worked. The strategy has really worked. And in moderate cases, in the third and fourth version, the moderate, there were not much of change. The treatment was hydroxychloroquine, and then this was eliminated. The azithromycin was eliminated here, and prednisolone, that is steroids, and low molecular weight heparin were added in moderate cases. And in severe cases, that you need to get admitted in a dedicated COVID hospital with ICU facilities where you may require a ventilator. So oxygen inhalation, of course, it was there in moderate, but of course, in severe cases, oxygen inhalation, or depending upon the severity, you may require ventilation. And then hydroxychloroquine, prednisolone, low molecular weight heparin. And then there were some investigational therapies which came in this version, which is, remdesivir and tocilizumab and convalescent plasma, of course, which is still under consideration or under trial. Then came the fifth version. So fifth version, we are now in 3rd July, in first week of July, we had this fifth version of treatment protocol for mild, moderate, and severe symptoms and disease. Again, in mild, you need to either be in home isolation or a COVID care center. And there is the treatment plan is symptomatic management with adequate hydration. And again, hydroxychloroquine is still indicated here in mild cases. And on moderate cases, you need to, because you will be requiring oxygen therapy, so you need to be in a dedicated COVID health center, and hydroxychloroquine and steroids and low molecular weight heparin and investigational therapies were indicated. And in severe disease, you need to, where the saturation falls below 90%, you need to be in a dedicated COVID hospital with ICU facilities. Here again, HCQ and steroids and low molecular weight heparin and investigational therapies, including convalescent plasma, was indicated. Now, this is a very, on a lighter vein, what all do we have? So what all we have been using for treatment, for prevention and treatment of COVID-19. So we have almost all the class of drugs and all the pathies, you can say. We have antimalarials, we have antibacterial, and remdesivir, which is antiviral. We have antiretroviral, we had antiparasitic, ivermectin, we have biologicals, that is tocilizumab, and we have NSAID in the form of aspirin, we have anticoagulants, we have steroids, we have vaccine, of course, which is emerging, BCG. People have used BCG and MMR vaccine. And of course, the final vaccine has to come for the cure of COVID and antacid. So you see, there are all sorts of drugs which have been used. Of course, we are still, as Dr. Navneet Bali very rightly mentioned, that we still don't have, the treatment. We are still evolving and we are still developing as far as the treatment is concerned, and we are learning, we are experiencing every day. And of course, the supportive therapy like vitamin C, the zinc, and some herbals people are using, coronil, and the homeopathic, which is arsenic. So all sorts of combinations and permutations and cocktails and are being used. And some of the doctors I have seen, they are not even following the protocols. They are using their own cocktails. So there are various, there are a lot of variations in treatment. And when I was admitted in the month of June, that time I was given HCQ, of course. It was in the mid of June. I was admitted on 8th of June and discharged on 20th June last month. And the treatment given was HCQ and of course, low molecular weight heparin and azithromycin, and then steroids. Of course, other supportive treatments were there. So I don't know if there is any class of pharmacology or any other pathy of drugs which is left here. So what more we will have in store, or what more to come, what else to come, we are uncertain, we don't know, we are still experiencing, we are still experimenting. Let's see how this disease takes the shape and what other protocols emerge in future. So the important slide, this is a very important slide. As we have evolved and we have developed over a period of time in our country, we have seen very good results. As Dr. Chavda mentioned in detail about the lockdowns, and we are into third lockdown, starting third lockdown from unlock period from tomorrow. We had first to fourth lockdown, then lockdown 1, lockdown 2, and now starting lockdown 3. So this has really helped. And what the strategy which the government followed was by the state government and central government in good coordination between them. There was early detection through aggressive testing. Initially, we had problem in testing for the coronavirus, this RT-PCR. There were very few labs. Until today, we have about 1,200 labs in the country, including the private and the government ones. So which is a good number. And the number of tests have also been increased. And there have been house-to-house surveys. And of course, the surveillance, we had about, in Delhi itself, we had about 1,000 surveillance officers who have gone from door to door to do the surveillance. And the state government has trained about 1,500 government school teachers to become the surveillance officer. And so this activity is being augmented. And of course, the most important thing which Dr. Gyani mentioned in his opening remarks in the webinar, that the augmentation of the health infrastructure, which is a ramped up 3-tier health infrastructure. And as on date in Delhi itself, we have about 53,000 beds. Of course, I do not have any data for the number of beds for COVID dedicated for COVID in the country, but Delhi, we have about 53,000 beds, and about 50% of the beds, that is nearly 50%, that is about 25,000 beds are contributed by the private sector. And effective containment plans of the hospitalized cases, and then periodic visits of central teams. So all the surveillance, monitoring, aggressive testing, contact tracing, and of course, as I mentioned, the treatment protocol, effective clinical management through well-executed protocol, standard of protocol, and home isolation. Home isolation has been very, very helpful and of late, and I've seen that the results have been very encouraging. People who remained in home isolation, it has really worked well and they have improved and the awareness has increased. So the sustained rise in the number of recoveries and the reduction in the case fatality is mainly the result of a well-formulated and executed strategy by the governments. Lastly, now, so how do we minimize fatality? So the crux is that first thing is prevention, as my previous speakers have already talked about prevention and those preventive measures to be taken. That is the social distancing, of course, and wearing of masks and use of sanitizers. And of course, most important thing is timely identification of the symptoms. I should know, I should not neglect my fever. Even if I have a mild fever, I should report to my doctor and self-monitor. I have to self-assess myself, self-monitor myself. And any early warning signs should trigger, I should be cautious and try to report to my doctor. So here the role of the first contact physician is very, very important. So, and then early detection is important. If you really want to minimize the fatality, early detection by timely testing. I would not say early testing, because early testing will not, even if you are harboring the virus, it will not show the positive report, positive result. So maybe, after 5 days of your symptoms, because it is, or maybe, not before that. So timely testing is important. And of course, testing, of course, we have been, talking about the RT-PCR, which is a gold standard for testing, and the nasal swab and oropharyngeal swab. and of course, rapid antigen testing, and then early quarantine or early isolation, whether it is home isolation, home quarantine, or it is quarantine in the hospital. Hospital quarantine is for those symptomatic patients and those with the associated comorbid conditions. And then timely treatment at COVID care center, as I mentioned, that depending upon the severity of illness, whether mild, moderate, or severe, you need to go to either a COVID care center or a dedicated COVID hospital, or the COVID healthcare center, or a dedicated COVID hospital. Like, the whole hospital has turned into COVID hospital with good ICU facilities. So in severe cases, we should land there, and the treatment should start, early intervention should start. And then, of course, even if you are admitted, proper monitoring of clinical conditions and investigations are very important, because like all those D-dimers and your TLC and other various parameters, your CRP, so these are very important parameters to be monitored during the admission. And of course, most important part of your monitoring is your breathlessness. If you feel breathless, or if your saturation falls below 90, so that should warn you to take action immediately. Whether you need oxygen is not helping, then you need ventilatory support, or you need intensive care therapy. So this is important, and this is following the latest treatment protocol. As I already mentioned, that we should not try to hit and trial for every patient. That depending upon the patient, the protocol, which is already the guidelines, the standard treatment protocol, should be followed to minimize the treatment. We don't know what will come in future, but whatever is there now, the latest guideline we have to follow. And of course, even if the patient is admitted, we have to minimize the fatality by taking good care of the infection prevention and control, standard precautions to be followed. We all know that the hand hygiene is important, wearing of PPEs and various other precautionary measures to be taken as an infection prevention and control measures. And of course, after the discharge of the patient, regular follow-up again, because the sequelae, if you see, even I was, after my discharge for about 2 weeks, I was not very comfortable. I was feeling fatigue and feeling tired when I climbed the stairs, so, or when I exert myself. So these sequelae for some people, for some patients, and depending upon the age and other comorbid conditions, the sequelae will last longer. The long-term effect of this disease will remain. So we have to be very, very careful and monitor ourselves. And then, of course, awareness has increased. We all have said that awareness has increased, and awareness is the key. And thank you very much. I think I have stuck to my time, and thank you for your patient listening. And thank you, Dr. Gyani. Thank you, AHPI. Thank you, Double Helical, Mr. Tiwari. And thank you, all the speakers and all the viewers here who are present to be a part of this webinar. Thank you very much.
Thank you, Dr. Phil. I must admire, the way you have compiled, not only the history of the protocols, how the protocols have evolved, but I think you have really given us the very, in the correct manner, how the fatalities can be reduced, have been reduced, and there is a scope now to further reduce. I think wonderful presentation. Actually, again, I'm really a little surprised that all three of the speakers have come out with an excellent presentation for the viewers. And now, because we have 20 minutes left, we have one speaker, and I'm awaiting, because this talk is going to be very important. That is going to tell us how do we live in the new normal and with the safety. And for that, I'm going to invite Dr. Yash Gulati, another clinician par excellence, working at the Apollo. And incidentally, he is from the same field as Dr. Chavra is. Both are orthopedic, both are spine surgeons. So let me invite Dr. Yash Gulati to tell us, how do we live in the new normal? Is Dr. Gulati joined? Yeah, he's there, yeah.
Oh, I've unmuted myself. Can you hear
Yes, please.
me? I didn't know that I have to unmute myself.
Good. Thank you so much.
And are my slides visible on the screen?
Yes, sir, very clear.
All right. Good evening, ladies and gentlemen, and thank you very much for inviting me for this talk. I've heard three eminent speakers, so I'm a little nervous now after having listened to such good talks. I hope I will come up. Now, see, but the good thing is that I don't have to talk about COVID itself. I have to talk about what's happening in the shadow of COVID and what we expect will happen and how we have to live, and the new term which has been coined, a new normal. First of all, let me just say, what is normal? Normal is something usual, something typical, something expected that we expect every day. That is normal. But does that mean that the term new normal, this kind of sanitizes the idea that the present is absolutely okay, that what we call normal is actually okay? That is the question. The fact of the matter is that this COVID has very badly exposed our healthcare system. We may be patting our back, we may be thumping our chests, saying that our mortality is low, our cases are not so bad. But the fact of the matter is that this has been so throughout Asia. It's something to do with genes, something to do with vaccination before, we don't know. But the fact is that there have been so many lacunae which we have seen. And I think we should learn from that so that this doesn't happen in future. Are we seeing what the state of our economy? Do we say it is normal? Our social fabric, do we say it is normal? So there are problems. So when we say normal to new normal, we don't know whether this new normal is really a very great term. So having said that, we come to the fact is that still in the country there are a huge number of cases which are happening, although is declining in some parts. And as I said earlier, and as everybody has said, fortunately the fatality rate is low. As I said, the system, our system, healthcare system, if you see it under microscope, has not come out very nicely. If you see the number of doctors, number of hospitals, number of beds per person, and the doctors had to go on strike during this time. So that is the state of our health. People are having IV sitting on the veranda, on the roadside. So we need to look into ourselves. We do need to do some introspection. This corona has given us a jolt. So the future, the new normal should not be this, and we should not be caught on the wrong foot. The fact of the matter is that because of corona, many businesses have shut. People have been confined to their homes. 96% of air travel has gone. It's plummeted by 96%. Millions of migrants, they had an exodus. The epidemiologists had warned us that this is happening, and we did not prepare. Fortunately, lockdown gave us some time to prepare, and fortunately, the mortality, the virulence of the virus in our part of the country, our part of the world was not too bad, and we seem to be getting away with it. But let's not be too complacent about it. Now, the fact of the matter is that if you see reports after reports after report that this corona is not going anywhere, it's here to stay. Even now, we do get some cases of H1N1. So this also will stay, maybe not to that extent. So we have to prepare ourselves thinking that this is here to stay. Now, if it is here to stay, things have changed, some things will change, whether the vaccination comes or not. So as I said, the new rhetoric of new normal. What is new normal? Are we going to be more unsafe because a lot of people are unemployed? As an individual, am I going to be very unsafe? Am I going to see my children sitting at home all the time, having to study on the screen, not going to college or going less? So many things have happened. And am I going to work from home? So is it going to be the new normal? And we are talking about staying home. What about the daily wages? Is there going to be a fight between a coronavirus and a hunger virus? So we need to think of all these things and then make a strategy on top of that. In the post-COVID or ensuing COVID that is going on, things are going to change. The global order is going to change. People are probably not going to rely on a unipolar world. People are not going to rely that everything is being manufactured in China and everything is going to be supplied from there. Even the disease which came from China, the PPE, people had to import from there. Instrument they had to import from there. So people are going to have less faith in unipolar world. They probably will go for multipolar world. Hopefully that will be the right thing to do. And similarly, things will change in society level, economy level. The companies will not run the way they are being run, not with this kind of technique that is being done. Artificial intelligence will take more role, and people will have different, even in household, individual, things are going to change. This is what, and coming, because I'm a doctor, I obviously, although my topic is a little broad, I need to speak more about the medical aspect of it. And did COVID hurt the non-COVID issues, non-COVID patients? The answer is very, very emphatic yes. There have been many patients who have been non-COVID problem which have been brushed on the carpet. They were not admitted in the hospitals. You do this test, you do that test, it will take 5 days, 4 days earlier. And many people suffered. There are reports after reports after report that non-COVID people suffered either because of the system or they were afraid themselves. They were afraid of catching corona. Their treatment has been delayed. Some routines have been turned into emergency. And because they have been delayed, some of them will probably have poor results. I talk of my own field in orthopedics. Fractures which were crying out to be fixed, patients did not go to hospitals. Some doctors were initially told, don't fix them. It's okay to leave them alone. And some doctors also left them alone. Elderly people, they had fractures around the hip. They did not go to the hospital. Bed sores, pneumonias, thrombosis, all these things did happen. So that's not the way things to go. That's not the way to go, because we know life is motion, motion is life. So we have to find a way. Now that this corona is going to stay, we need to find a safe way for people to get the treatment what they deserve. And fortunately, systems are getting into place and we should be able to do it. Similarly, for cancer, there was a very difficult choice between rock and a hard place. Do I risk getting corona or do I risk getting my cancer worsened with time? Do I get my cancer detected early? Do I get my biopsies done? So there's been so much of confusion. Even a cancer patient for chemotherapy, each time he came to the hospital, he had to do a COVID test. So all these things have happened. We cannot have a repeat of this. So we need to have systems set right so that such things do not happen. Similarly for cardiac, renal things, renal transplant, liver transplant, so many things. So let non-COVID issues not be ignored. All these diseases have not disappeared. They are here. They are only they are probably going to turn into another endemic or a pandemic, because these things will not go away. So we need to think about it in the so-called new normal. The corona should not scare us, and the patient should not be scared of getting treated because of corona, because we have to have systems in place. So what is the way forward? We need to have changing norms. Yes, we will have changing norms. We will not have these kind of get-togethers. We will not have these kind of crowds for traveling. Yes, probably we'll spend more time at home, as much work from home as possible. Education system will probably change. Way of doing businesses will probably change. Yes, but we will not be scared. This thing, probably handshakes and kissing and all these things and hugging probably will go, and namaste will do. These norms, distancing will probably stay for foreseeable future. So be it. That's fine. Then, of course, we'll use masks because we know they're going to be effective. So we need to extrapolate what is going to happen in the next 3 months, what is going to happen in the next 6 months, what is going to happen in the next 2 years. So we need to make a strategy. For example, in next 3 to 6 months, the situation is dynamic. In some part of the country, it is already plateauing. In some part of the country, it is peaking, like in Delhi, it's probably getting controlled. In Bihar, it is peaking. So we need to have a strategy depending on what is going on in that part. So it's a dynamic situation. And where it is plateauing, we probably need to relieve the tertiary hospitals from the burden of admitting corona patients. We need to relieve those beds so that other treatment can carry on. If there is a problem, then ICUs, etc., can be reserved from them. So we need to think about it. We can't just make one full hospital a corona hospital and not do other treatments. So similarly, we need to strategize at the government level, at a society level, the role of Mohalla clinics, the role of primary centers, the role of district and super specialty hospitals. And many a time, private medicine has been labeled as profiteers. There have been so many newspapers, so many this, that look, this is what is happening. But we have to accept, in a country like ours, private medicine is going to play as much, if not more, role than the government setup. So we need to define what the clinics can do, what nursing home will do, what small hospital and tertiary centers. So let's not burden tertiary centers for just admitting plain corona patients. Probably the ones which need ICU is fine. Others should be admitted somewhere else in the time to come. And the hospitals themselves need to organize themselves. We have learned from H1N1 experience. We have learned how to deal with that. So the first principle is primum non nocere. That is, Hippocrates said that anybody who comes to the hospital, let there be no more harm that there is already. So we need to isolate. We need to have everything kind of a vertical division. One corona, H1N1, etc., and others in the other wing, or protocol set in a way that they don't come in contact. Even for doing CT, MRI, we need to have protocols so that nobody catches infection from them. And we have to isolate the ward, we'll have isolation beds, and all these things are, of course, protocols are being followed, and this will have to be done. And as I said, private healthcare is going to play a very important part in the time to come. But the thing is, there are job losses, there is less affordability, not many people have insurance. So we need to also make private healthcare as affordable to people as possible, in that we need to indigenize. We should not be using very expensive imported items which we need to use. We take the example of PPE. In the beginning of this endemic or pandemic, we had to import PPE, but the country is now exporting. There are many hip and knee implants we used to import. They are now being made in India. Many fracture implants are made in India. So the government has to take a step. We should not be in a stage when on Diwali I have to use the Ganesh made in China. There's no need. So we have to change our mentality. We have to promote make in India, actually do it in real life. And then only we can make the private medicine cheaper. We have to encourage medical tourism. That will not only increase our expertise, but also will bring dollars to our country. So all these things will make private medicine thrive and make it cheaper, because at the end of the day, we cannot compromise with quality. That is one thing we can't do. So we have to do other things. So we need to build health infrastructure. As I said in the beginning, we have been caught on the wrong foot. Our investment in health infrastructure is less than 3% of GDP. It's 21% in Canada. So we need to at least increase to 8 to 10% in the short term, and then increase it further. So, and as I said, use products made in India. We need to change our administrative structure. In this pandemic, you've seen how bureaucrats and politicians have been running the whole show, and they messed up at many places. There have been some stupid orders like, if a doctor has caught corona, explain why he got it. Even today's newspaper, there was an item that if a doctor has worked in a corona thing and he got infection and he took quarantine, that leave cannot be adjusted. For a daily kind of casual doctor, he has to pay for that. I mean, these are kind of things which we don't want, this kind of bureaucracy. It's a professional problem. Let the professionals take the lead in this. This is what I strongly feel, because other people don't understand what's going on. So what is new normal? It should not be elitist. What we have seen in Chicago, 30% of population is Afro-American, but 70% of the deaths were in Afro-American. So this kind of dichotomy should not happen. So we need to balance these things in future that is to come. And we need to reassure at our level, public level, doctors, The government has to reassure people that things are getting controlled. Media also has to be checked in, not give sensational reports like one report from LNJP hospital and show it like this is the normal. I mean, you catch somebody on the wrong foot for whatever reason, and then I think we should stop sensationalizing these things. And also, at the end of the day, a lot of people are going to lose jobs. A lot of people have been indoors. A lot of people have, not interacted socially. There's going to be a social issue. There's going to be a psychological issue. There are going to be increased suicides because of job losses, financial constraint, indoor confinement. So we need to have a strong psychological and psychiatric help available. We need to prepare for that. I mean, otherwise at 6 months, we will see that we will have many of these problems happening. So this is what the roadmap we need to do. And at the present moment, we should not try to see everything through the prism of new normal. Let's deal with the things on merit today, because things, as I said, are dynamic, and we should start preparing as things happen. But this normal, a new normal, these terminologies, to me, they don't make sense. I think we have to deal with the situation and prepare for the situation that is to come. And I think that's my way of thinking, is that always think positive, क्योंकि शम्मा बुझ जाए तो फिर से जल सकती है, कश्ती दरे तूफान से निकल सकती है, गम न कर अपना इरादा न बदल, किस्मत किसी वक्त बदल सकती है. So we can turn adversity into opportunity, and that's the way we should do it. Thank you for your attention.
Well done, sir.
Thank you, Dr. Gulati. In fact, I was thinking, I spoke to him that he should speak on how do we reduce the fatalities. That is what the topic I wanted to give him. But, I am seeing the hidden, side of Dr. Gulati. He has come out of his comfort zone of an excellent clinician, and he spoke on a very social issue. And I think wonderful presentation. I have picked up one question from the viewer, who have raised the question. The first question is for Dr. Chabra. Is he there?
Yes, sir. I'm there, sir.
The question for you is from the viewer that initially everybody was talking that this infection is coming through the droplet, surface, touching, and we were not wearing the mask. But today everybody is talking that no, surface touching the food items or they are not important. It is all aerosol. Now, where is the confusion? Is it completely aerosol now or mix of it? Which is the more dangerous one where the people have to be careful?
Yes, sir. Very good question. Now, it's not that droplet infection is not the cause or contact transmission is not the cause. That is an established cause which has been well established. The question always has been, some people have done some experiments, and because this infection was so contagious that not having immunity to this viral disease was one factor, but people were thinking, is there something else which makes it so contagious? So they did some studies and found out that droplets which come out remain in the air for quite some while after the person passes from there. And this could probably result in airborne transmission. So there was a study which was published in Lancet, which attracted a huge interest in this regard. But WHO initially said, no, there is no proper evidence, and you can't replicate. You can't say that experiment would replicate what happens in the real life scenario. But of late, because of more evidence in this regard, WHO has also accepted that this may be a possibility, even though it is not established. And this may explain the very high contagiousness of the virus and how it spreads like anything. So where the droplets, which are the aerosol which is there in the air, it may lead to infection to people even after the person has passed by there over 4 or 5 minutes later or even later. But the mask would hold true even whether it is a droplet infection or aerosol infection, because the mask will prevent the droplets from coming out, right? But so if since contact transmission is there, it will help in that case. It is a separate matter, that in aerosol generating procedures, like happens when you do a tracheostomy or when you intubate a person or when you do certain operative procedures, whether a N95 mask is useful or not, you can't say, because the pores of the N95 mask are bigger than the size of the virus per se, much bigger. So we still don't know a lot about the virus. We still need to know a lot more, and still evidence will keep coming up. And that's how your new normals to adapt to the pandemic and the COVID infection will also keep evolving with time. So you can't have a certain protocol accepted for long. It will evolve as the evidence evolves about the virus.
That's right. Thank you so much. And I have a question raised by one of them about for Commander Navneet Bali. Now, is he there?
Yes, sir. Yes, sir. Please go ahead.
Yeah, the question for you is that he says you have made people fearless now by your talk. But, is it can lead to the carelessness? How are you going to tell people that be fearless, but don't be careless?
Sir, I think, yeah, you're right. No, so, I think as far as the professional doctors are concerned, they are much wiser now, and they realize that, being careless is going to lead us into more trouble. So as far as the educated class is concerned, I think it's very, very clear right now that people have started following the norms which are required to be followed. As far as the healthcare workers are concerned now, I think the infection rates amongst the healthcare workers, where especially they're using PPEs, etc., is much, much lower. So there is no carelessness, seen most of the places as far as healthcare workers are concerned. Of course, there can be isolated incidents here and there. Talking about the population in large in the society, all those places where societies are much more disciplined and they've realized that, now there is no shortage of PPEs, etc., etc. So you can be fearless, but you cannot be stupid. And if you're fearless, but at the same time careful about following etc., I think you'll be much.
So that means our healthcare workers are fine, but the general population have to have a bit of fear, and then we cannot be afford to be careless. I absolutely agree with you. So I think then I will have a question for Dr. Khetrapal. I think one person is asking me that in the hospital, particularly the remdesivir, this medicine hospitals are asking patient to buy and bring. They say this is not an order, because in the market this medicine is available sometimes at 10 times the cost. This has appeared in the newspaper also. So why come hospitals are not procuring and then administering to the patient and charging for it? Is there any issue in the hospitals? Are you aware about it?
Sir, as far as this drug is concerned, remdesivir, in fact, nobody was prepared to have adequate stock of this drug. And, the hospitals were just having the sufficient stock for their own patients. And I remember when somebody approached me, patient was admitted in Gangaram Hospital, and one of my doctor friend who was admitted in ICU, and he was on ventilator, he required this drug. So I had to, very quietly, I had to help him from supplying the drug to him from my own hospital, of course, at a concessional rate, because we give 10% discount on all the drugs. And because of the short supply from the company, and the companies were also not prepared, so this supply, in fact, nobody could help it. So of course, in the black market, it will definitely be at a much higher rate, because some people, when they realize that that this drug is now going to be used by many of the hospitals, so they have stocked the drug and then they started selling it in the black market. But hospitals, of course, they sold it well within the MRP. And of course, this black market in COVID era, that there are some opportunists, those who they were trying to have their own vested interest. So that was the thing, in fact. Otherwise, hospitals
Yeah.
are not,
Are
having problems.
supposed to keep, yeah. So maybe the short supply, even hospitals were not able to procure.
Yes.
And last question I picked up for Dr. Gulati about new normal. He has explained everything wonderfully well, but one comment has come that you explained that there are 0.7 beds per 1,000. The question on my mobile is that they say it is actually 0.7 beds are in the government sector. Overall country 1.3 beds per 1,000, which is also 2.5 times shorter than what is required under the WHO. That is 3.5. So the question to you is, after listening to you, beautifully, the kind of background you have, wider exposure you have, can you tell us this in a shorter run? How do we make good of this number of beds in the private sector? Because let me also tell you from my own opinion. When the COVID started, there was a case in Supreme Court, which we also are, fighting along for the hospital. There was a talk that hospital should be, healthcare industry should be nationalized. And but I was the one who presented in WhatsApp group in the government that why not it be completely privatized, other way around, after seeing the inefficiency in the government. But that is beside the point. Point here is, how do you double the number of beds? Can you do it in the next 5 years? And accordingly, last question along with this, that even if you increase the number of beds, where are the doctors? Where are the specialists? Please answer very quickly these two aspects. In next 5 years, what is your roadmap to the government that we can match or make up this deficiency?
Thank you for this question. I have actually, I'll answer this second question one, because that's a very important question. And I've been writing about it, and I've been talking about it, that, you have created 10,000 bed at Radhaswamy Satsang thing. Where are the doctors? Where are the nurses? Where are the paramedics? What's the point of all this? So important thing is, right in the beginning, actually I sent a suggestion that the non-respiratory people, even surgeons should be trained in using ventilators. They should be trained in treating these things. Fortunately, this disease did not turn out to be so bad. But the thing is, we need to train whatever resources we have, and we need to have more resources. And there was this talk of getting other non-allopathic people also. I don't mind. So long as you can train them for doing a particular job, yes, you should be able to get their services. So the key answer to that is we need to train more people. Training is the key. And the second question is that private beds can be increased, but private people, unfortunately or fortunately, has gone in the hands of businessmen, majority of it. And they are here to make profit. They are not, they may be giving slogans of, I want to do this, our humanity. At the end of the day, they are there for making a profit. And that's fine. I have no problem with that. And if a lawyer can make a profit, if a shopkeeper can make a profit, if, hotel guy can make a profit, so everybody should make a profit, that's fine. But like we expect honesty from other professions, we should also be honest. We should not be overcharging people. Our profession, teaching profession, judiciary is such that people expect much higher moral than other people. So we have to live to that. This is the role we have been given. After all, we do get that respect also many times, which is much more than other people. So to summarize it, I think there is no harm in making money, but we should not be exploiting the situation. And people should also understand that private medicine, people have to earn their living out of that. So they should not blame them. They are not exploiting, they are not fleecing people. But we need to come somewhere midway. And the beds can be increased in private as well as in government. I don't think there's a problem.
I know. Actually, so only I will say that because of the COVID, I think it is good. One good point has been that government also has realized that for past 70 years, healthcare has been neglected. Hopefully, they will have more attention. They will take private sector naturally along with them. And we should see the healthcare in the new avatar post-COVID. I think with that, I will tell you that this has been, I will rate this webinar as most useful, value addition to, people on the Facebook and on the YouTube. Very well done, all four of you. And thanks from my side. And thanks to Amresh Kumar Tiwari, and close the seminar, but I will tell Amresh to convey a vote of thanks.
Thanks a
Thank
lot
you
to-
for conducting it so well, Dr. Gyan.
Thanks
Thank
a
you,
lot
sir.
for all my viewers, my eminent speakers. I also welcome to our one of the advisory member who is there looking on the Facebook that our screen, Dr. Vijay Agarwal, and of the my key guest, Dr. Neelam Bhons, is from Vedanta City, Vedanta Hospital, Gurgaon, and Dr. Chabra, Dr. Ketrapal, Dr. Esculati, Dr. Gitter Gyani ji, he has a magic to moderate this any one webinar. So I'm really thankful for all of you, Dr. Khetpal, Dr. Commander Nodit Bahal, and all of you. Thanks, and we are coming up very soon. As we decide to talk, we'll let you know. Thank you.
Thank you. See you again.
Thank you, sir. Thank you very much.
Thank you.
Thank you so much.